The World Health Organization's Director General, Dr. Tedros has called on world leaders to put their differences aside and build a better world. An emotional Tedros used the recent conflict around the world as an example of what should not be allowed to continue. Dr. Tedros, who was addressing the 75th World Health Assembly, has been nominated for the second term at the helm of the World Health Body.
For me, this is not hypothetical or abstract. It's real and it's personal. I'm a child war. I'm a child of war. The sound of gunfire and shells whistling through the air, the smell of smoke after they struck, tracer bullets in the night sky, the fear, the pain, the loss. These things have stayed with me throughout my life because I was in the middle of war when I was very young, maybe 10, maybe 11, maybe 9. During that range. Like the mothers I met in Yemen and Ukraine. My mother's concern was to keep me and my sisters and brothers safe. When my mother heard gunfire at night, she would make us sleep under the bed and lay more mattresses on top of that one bed, and all children crammed in under the bed, in the hope we might be protected if a shell fell on our house. I felt that same fear as a parent myself again in 1998, when war returned to Ethiopia and my children had to hide in a bunker to shelter from the bombardment. And that's when I returned from Nottingham, where I was doing my PhD, because I was worried about family and also the rest of the country. Maybe you remember in 1998 what happened. I feel the same pain and loss again now, with war in my homeland once again. Not only a child of war, but following me throughout. But my story is not unique. It's like so many others, the story of a family who did not start the war, who were not responsible for it, but suffered because of it. And all could be centered because of bad governance, lack of leadership. War is bad enough, but it's made worse because it creates the conditions for disease to spread. Indeed, war, hunger, and disease are old friends. In the Napoleonic Wars and the American Civil War, more soldiers died from disease than in battle. It was no coincidence that the 1918 influenza pandemic, the greatest pandemic, coincided with what was then the greatest war the world had known, the First World War. It's no coincidence that the final frontier for eradicating polio is in the most insecure regions of Afghanistan and Pakistan. It's no coincidence that in 2018, the Ebola outbreak in the relatively stable Equator province of DRC took 2 months to control, while the outbreak in the insecure regions of North Kivu and Ituri took 2 years. Where war goes, hunger and disease follow shortly behind. The COVID-19 pandemic did not cause the war in Ukraine, and the war did not cause the pandemic, but they're now intertwined. Until this year, Ukraine was among the countries that was making the most rapid progress toward this universal health coverage. We're deeply concerned about the impact of the war on these gains. Already we have seen many clinics and hospitals closed, health workers displaced, and services disrupted. I visited a hospital in the town of Makariv, west of Kyiv. Its inpatient department had been damaged by a missile strike, and its primary care department was completely destroyed. And it's not just Ukraine. So far this year, WHO has verified 373 attacks on health in 14 countries and territories, claiming the lives of 154 health workers and patients and leaving 131 injured. Even WHO is targeted. In 2019, our colleagues, Dr. Richard Muzoko from Cameroon and Belinda Kasongo from DRC were murdered in DRC while working to protect others from Ebola. Attacks on health workers and health facilities are a breach of international humanitarian law.